It was Time magazine like 10 years ago. They said there's this one underlying factor that is the common denominator in all chronic disease. What do you guys think it is? Inflammation. So if inflammation is a common denominator in all chronic disease, how do we quantify inflammation? The number one lab test to quantify inflammation is something called HS-CRP, high sensitivity C-reactive protein. This is the gold standard of looking at systemic inflammation. Now it's not like you stubbed your big toe and your big toe is swollen. It's literally every single cell in your body is being impacted by inflammation. Now, again, understand that in Western medicine and functional medicine, we run the same lab, but we look at the numbers differently. Again, Western medicine looks at more of like a disease process. So they, depending upon the lab you look at, they usually want you less than 1, or one lab they use 0.9. In functional medicine, the gold standard is less than 0.3. 0.3. Now, I have seen CRP numbers above 10, and that is crazy scary. Yet just yesterday, I had a very healthy woman. She was a nurse. She was concerned about her thyroid numbers, and her HS-CRP number was 3.5. So what does that tell us from a laboratory standpoint? It tells us there is something that is causing a substantial inflammatory condition in the body. So what are some of those things? So the number one thing I look at when I see HS-CRP elevated is I look for leaky gut syndrome. And we'll talk about that. Maybe I have already in a video. We'll talk about leaky gut syndrome. Literally food particles, pathogens passing through your intestines into your bloodstream. Next thing I see is autoimmunity. And the other thing I see then is chronic infection. So this, in my opinion, are the top 3 reasons why I see elevated HS-CRP. So HS-CRP less than 0.3. Take care, guys.